Thank you. And I'd like to call to order the joint CRS-KRS Retiree Health Plan Committee for September the 3rd. Uh, May we have our opening statement, Mr. Board?
Yes, sir. This is a regular meeting of the joint CERS and KRS Retiree Health Plan Committee. This meeting is being broadcast via video teleconference pursuant to Kentucky Revised Statute Section 61.826 and may be viewed by the public at the Kentucky Public Pensions Authority offices located at 1260 Louisville Road in Frankfort, Kentucky. It is also being broadcast to the public via Facebook. If you are speaking and not appearing by video, please identify yourself before talking. In the event the video or audio broadcast is interrupted, we will attempt to reestablish a connection. If a connection cannot be reestablished within 30 minutes, the meeting will be adjourned and rescheduled to another date. Thank you.
Thank you, sir. Ms. Rankin, do we have any public comment?
No public comment.
All right, thank you. That moves us on to item 5, approval of committee minutes. Now,
Mr. Powell, did you want me to do roll call?
Well, that probably ought to come in handy.
Sure, I'll take care of that for you. Mr. Powell?
Here.
Mr. Fulkerson?
Here.
Dr. Miller?
Here.
And Mr. Piercy?
Here.
Thank you.
All right, thank you. Now moving on to number 5, the approval of the committee minutes from May the 8th. Everybody had a chance to review. Is there any questions, comments, clarifications you'd like to present? Hearing none, I'll entertain a motion to accept those minutes as written.
So moved.
Have a first and a second. Any further comment? All in favor say aye.
Aye.
Opposed? Ayes have it. Number 6, the establishment of the 2025 health insurance components and the insurance rate. Madam Pettyjohn.
Yes, sir. Thank you, Mr. Powell. This is the presentation for the plans offered by the state of Kentucky to the non-Medicare eligible or early retirees. It is a plan that is sponsored by the state of Kentucky, specifically the Department of Employee Insurance under the Personnel Cabinet, and it is the Kentucky Employees Health Plan is the name. Next slide, Sherry, please. I just wanted to remind you, the statutes do govern this plan and some of the design of this plan. There are really not any benefit changes this year, and the premiums are not changing. So those are 2 factors to consider as I go through this. Next slide. And this is just how the actuary looks at the statute to comply with offering the plans. As they're the same as last year, you can assume the value is the same. And we'll start off with, I believe, the Living Well PPO. Sherry is next. This slide is the slide you've selected since for a number of years as the contribution slide, or the slide that if you have 240 months of service credit, hired prior to 7/1/2003, and are on the 100% contribution, which means you've worked over 240 months or greater, then this plan is paid at the 100% for the single retiree. And the board has selected this plan also to be the one for the hazardous duty retirees and dependents. The plan value is the same. The copay structure, member out-of-pocket cost is the same. And the premium to the trust is the same as it was in 2024. It is the only plan that does have a copay structure for primary care and physician specialist, and it has a copay at the drugstore. There are still 2 tiers offered by the same. Now, I'm saying offered by the same vendor. CVS Caremark is still the vendor for the pharmacy benefit, but I will tell you that the medical benefit, they have went through an RFP, request for proposal, at the Department of Employee Insurance this year, and they have not actually signed the contract yet, but please keep in mind these plans are branded by the Department of Employee Insurance, the state of Kentucky, and belong to them as a design and so forth. So I don't have the vendor yet. I look to have that shortly. We just had our meeting last week. Mr. Powell was in attendance, and they still haven't signed it. So that is pending. It looks like there's no issues with that, is what they're telling me. And unless you have any questions around any of that, I'll go on to the next slide. Okay. This slide is also the same. It's a Living Well CDHP, the same as offered in 2024. It has the HRA for the family and single. It does not have a copay structure, but the medication and the medical benefit go against the same deductible and out of pocket together. So that provides a little bit of assistance. And lots of family coverage are involved in this because it has that HRA that will roll over a little every year. The value of the plan is 80/20, and that hasn't changed. Next, Sherry, is the Living Well Basic CDHP. Now, this plan is the plan you all selected for the default plan for the Kentucky Employees Health Plan for the retirees who are new retirees and failed to complete an application so they could be defaulted into this plan of coverage. It has not changed in value. They haven't changed the benefits. It does have the two-tier formulary. There is a copay structure with that formulary. And the legislators decided that in 2025, they wanted to bring a plan back. Sherry, that is the next plan. They decided that they needed a high deductible health plan, which is something that maybe young state employees would like. Single level, it provides catastrophic. It doesn't have the HRA. It's very similar to a plan they had in the past that was called high deductible health plan. This one, I've got another little bit of information on in the next slide, but it's a 70/30 plan, so it just doesn't have an HRA. And the first, you have to meet 2,000 out of pocket to select it. So this is, like I said, the legislators wanted this plan option available, and so the Department of Employee Insurance has added it for 2025. Any questions around the plans? That's basically the same four. Well, three were offered last year. This fourth one is a new one. And really no benefit structure. This is a new benefit grid, but it looks, it does cover similar things to that high deductible health plan, which retirees had access to back in 2022, I believe. Okay, Sherry, the next slide, please. Now, because of just changes in the way the Affordable Care Act and the cafeteria plan rules that govern Department of Employee Insurance are, they have decided to go away from a default plan, other than they will do a waiver without HRA for state employees. We are looking at a decision they're going to allow us to use either the new plan. I'm sorry, go ahead. Department of Employee Insurance is going to allow the retirees to continue to use a default plan for next year. They are allowing us a choice. The Living Well Basic CDHP is the one that you selected for 2024. You can continue that plan, or you can change to this high deductible health plan. Now, I will tell you that plan is cheaper, but it does not allow access to the live health online, the telehealth that's free for retirees and state employees. Hinge Health, which is a musculoskeletal outreach and exercise program, as well as pain management. Carum Health is an access program to cancer and other networks that might be a little more cost effective for the retiree. And UK's acupuncture program is going well for pain management. So that is not offered, but it's offered on all the other plans. So when we get to the voting slide, if you would select number 1 or number 2, and just know that there's a slightly higher premium on the CDHP plan single level. It costs $65.62 more than the Living Well high deductible plan. And I can't show you the premium for that plan because it's not put into law by DEI and the legislators until September the 15th.
Didn't we used to have the high deductible plan as our default plan prior when they were offering it previously?
Yes, sir, we did. But that plan at that time offered some of these benefits, and I wanted to show you the difference and make sure you incorporated that benefit
Okay.
in your
I just want to
decision.
check my memory there, but yeah.
You perfect, spot on. Any other questions around this slide? Okay, Sherry. The next one, please. Tobacco use has not changed. It's still the tobacco products. It's not cigarettes, pipe, or chewing. It is chewing. I'm sorry. It is not limited to cigarettes, pipes, chewing tobacco, snuff, dip, and other tobacco products. And Dr. Miller, Mr. Powell, and I questioned the board about the vaping. I may have already given you an update, but they cannot add that to this tobacco use, although they do incorporate some of that outreach and some of those preventive measures in their messaging. The tobacco fee for the retiree at the single level of coverage is $40. If they're choosing a couple, parent plus or family, it's $80, as it has been in the past. Well, I think 2014. That's when they changed this. Next slide, Sherry. This is the Living Well promise. It will still be offered in 2025, and the retiree and or plan holder would need to complete the promise between January and July of 2025 in order to receive this $40 deduction. And this is something that has been the same for a number of years. They've had this. If somebody's cross-referencing, both retiree and spouse have to complete it. And they do have avenues for people who have disabilities to reach out. And this hasn't changed. So if there's no questions, Sherry, please proceed. I will, short FYI, tell you where we put this notice out every year. It goes in the new retiree book that we're mailing at the end of the month. It goes to the annual open enrollment materials, which is what we're referring to with the book, and still some additional materials. It is on our website. We do social media posts throughout the year. And it is on the enrollment, which is online, as well as they can submit paper enrollments as it has been every year. And a reminder is sent in July. We send an email specifically to people on the KEEP plan that haven't completed the promise and give them the deadline is coming, July 1. So just informational. Sherry, I believe we're ready for the cross-reference is changing. This is the one area, but it's not, well, it is a benefit for certain people who, it is for retirees and their spouse. Let's say they're both working for state government. It can be two employees, it can be one retiree and one spouse working for state government, or two retirees on a family plan that are still non-Medicare eligible. Well, if they choose this option during open enrollment, they can continue the option next year. But the Department of Employee Insurance is sunsetting this benefit due to their, quote, what they told us is the cafeteria plan rules and ongoing system and process complications around providing this benefit. I did tell you a number of years ago, this benefit is unique to the state of Kentucky, and it's not in any other state in the union. So just kind of an FYI, people currently enrolled this year on cross-reference will roll over to continue for next year. So any questions around that cross-reference? It is an 18A under the statute, but I don't know when they're going to change that, but that is something that looks like they are planning on changing and sunsetting. So you may hear a little different take next year. It may not even be offered. But there are some specific rules around that. The Department of Employee Insurance is still developing, so we have to be able to answer those questions for our retirees that don't fit into this category. Pardon me. And Sherry, I'm ready for the next slide if we are. I did want to show you the premiums since we can look at them this year, and they are still subject to approval by the legislators on the 15th of September. But knowing that the Living Well deductible, high deductible health plan is, like I said, it's $65 higher on the single rate. I wanted to let you know that just kind of see the snapshot of what the plans are costing as of 2024 and then again in 2025. Sherry, I'm ready for the next slide. And this is the decision points. So Mr. Powell, we can look at all of these individually, roll them up into one. And I do believe that Mr. Board has a motion sheet if you need that, or maybe Vicki Held provided it. Do you want to go through these one by one, or how would we
Yeah, I
like
think
to?
that would probably be better. Let's go through them one by one.
Yes, sir.
All right. The first decision we have to make is to approve the health insurance recommendation, which would be in the living, which I suggest would be the Living Well PPO plan with a $9.49 premium. Any thoughts on this one? I think this is the same plan we've recommended as the basic plan and cost from the beginning.
Yes, sir, it is.
I'll make that motion. Second.
All right, thank you, sir. I have first and second. Any discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. The next item will be the default plan. As Patty John discussed, we have basically two choices we probably should look at. It's the Living Well high deductible plan or the Living Well basic CDHP plan. Any thoughts?
I would just suggest
Am I
we stick
frozen?
with what we had, the CDHP.
The basic CDHP, sir.
Yeah, well, just carry
basic
over.
CDHP.
Yeah,
Carry over.
what we had last year.
Yes, sir.
Yeah, that would be the Living Well basic CDHP plan.
Yes, sir.
Any other thoughts? Any other opinions? Hearing none, we'll entertain a motion that the default plan for 2025 will be the Living Well Basic CDHP plan. Entertain that motion.
Yeah, so moved.
Second.
Have a first and a second. Any further discussion? All in favor say aye.
Aye.
Opposed? Motion carries. Next item would be the motion to allow the cross-referencing option for the retirees for the 2025 plan year. Any thoughts or discussions, or I will entertain a motion.
I'll make a motion.
I have a
Second.
first and a second. Any further discussion? All in favor say aye.
Aye.
Opposed? Motion carries. The last for this one would be to set the premium for the KEHP Medicare Second Payer Plan. This is the one, for those that don't remember, the Medicare Second Payer Plan is when they're Medicare eligible, they've gone back to work, and we had to provide insurance, and they're not covered by Medicare. Yes, ma'am.
Mr. Powell, I was going to let you know that DEI, the Department of Employee Insurance, did not charge an additional premium for this group of retirees. So you can continue with basically the decision made for number one that would for this one.
Right. And that's where
Okay.
I was going establish the Living Well PPO plan for the Medicare Second Payer Plan for 25. Any discussion? or I'll entertain a motion.
I'll make the motion.
I have
Second.
first, second. Any discussion? All in favor say aye.
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 Opposed? Motion carries. I think that covers all of our points on that one, doesn't it, Mr. Pettyjohn?
Yes, sir. And I just
All
had
right.
some numbers of people enrolled in the plans for the next slide. It's kind of an informational and some vendors. So that just shows, you know, we do have a little less, but we have the baby boomers retiring into the Medicare plans and or, you know, so that's kind of why we have a smaller population for the under 65, I think.
Connie, do
And
we need to do a separate motion to set the spouse dependent and all that rate, or did the first one cover that?
the first one should have covered it. Everything under that number, go back, Sherry, will you, one slide? Everything under that is included in that vote, I
Okay.
believe.
All right. Good
Yeah,
enough.
because we did the whole plan
Okay.
for that.
Thank you though for checking, Mr. Piercy. I don't want to come back.
Like we did last year.
Yes, sir. Okay, Sherry, that's all. I just wanted to show them that, you know, the small fluctuation in numbers. And that's it. That's pretty much it, other than the vendors are back here. And a light is going away. I apologize. That very last one, I should have taken it off the slide. No more light audits. DEI is doing them by capturing the documents when the individuals retire, etc.
I'm glad to hear that, because I get about 5 calls a year of people furious that they keep having to come up with the same information.
Yes, sir. It was every 2 years.
Yep.
So good.
That's always good news. And
Yep.
as a reminder, we need to do those who are under hazardous duty, look for the spousal contributions. Still need to do the 6252.
Thank you for that reminder, Mr. Powell. I appreciate that. 6256.
Oh, 656.
Yes, sir.
But that, you know, that has to be completed every year. So
By
for
November
those
the
people
30th. Yeah, we give you a few months and then we'll give you a few more if you need it.
So just a quick reminder there. I don't think we can say that enough sometimes after some of the issues we've had previously.
It's on the front cover of the plan book and it stays there.
Exactly.
That's one of them. Yeah, that and the Living Well Promise. So
anything else on the KEHP plan before we move on to the Medicare? Okay. Next item will be the components and rates for the 2025 insurance for the Medicare eligible retirees. It's still you, Ms. Pettyjohn, and your team.
Good morning. It's Tracy Garrison with Humana. Hope everybody's doing great. Thank you for the opportunity to come and present the Humana Medicare Advantage rates and information for 2025. Sherry, if you want to go to the next slide. Well, Connie, I don't know if you had anything to say before I get started.
no, I
She's
do
taking a
not.
break.
Thank you. Yes, sir.
I just sort of jumped in there, so just wanted to make sure. All right. So we'll talk about the plan changes. Oh, Sherry, you want to take me back 2 slides, maybe? Let's see. Yeah, let's just look at the agenda. So I'm going to talk about the plan changes that are coming for 2025. They are significant in the pharmacy space, so we'll spend a little bit of time on that. We'll review the individual rate changes that are coming for the Medicare Advantage plans, along with the self-funded plans that you have. And then we've got the rate exhibits and appendix, which we probably won't really need to go over, but it's there if we need reference to. So back 2 slides forward, we can go to, Sherry. Thank you. So the Part D cost share changes, we have been talking about the changes that are coming for 2025 for a few years now, actually, as they are part of the IRA, the Inflation Reduction Act. That was passed. I think the changes first started in 2023. But 2025 really makes the unprecedented changes to the plan and the program and the way that it is being administered on the Part D drug plan. So it's a great enhancement for your members, But these changes do considerably increase the financial liability faced by the Part D plan sponsor and the employer groups like KPPA who offer group Medicare Advantage plans. So you will see that reflected in the renewal rate for 2025. But looking at the changes that are being implemented for 2025, the Part D redesign, all plans will have an out-of-pocket threshold of $2,000 of incurred cost. So this is a significant reduction from the current 2024 threshold, which is $8,000. This $2,000 is calculated based on the co-pays and co-insurance that the member contributes to their drug spend, but it also accounts for payments that are made and portions of the drug payment that is covered by the plan and the employer group. So in most cases, we do not expect that members will actually pay that $2,000 out of their pocket. There will be a combination of what they pay and what the plan pays to get them to that $2,000. Additionally, also a great benefit enhancement, once they hit that $2,000 maximum out-of-pocket threshold, the plan will pay for the prescription medications the rest of the year at 100%. The Inflation Reduction Act has also introduced what's called MOOP smoothing. So that maximum out of pocket, members have an opportunity to smooth that drug payment cost over the course of the plan year. In just a minute, I've got a specific slide on that. But before we move to that, you can see on the left-hand side of the page, the 2024 phases as compared to 2025. You've got the deductible is going up to $590 on a standard plan. So this is not, neither of your plans are exactly standard, but all of this gets calculated behind the scenes. So we like to use this as a baseline. So $590 for the deductible. KPPA is holding that deductible on the essential plan at the 2020 level, which is $435. So that will not change for your members. It will not increase on that essential plan. And the initial coverage limit in 2024 was $5,030. The coverage gap has been eliminated for 2025 for that, so that initial coverage limit threshold does not apply. And then we talked about the out-of-pocket threshold, which is going from $8,000 to $2,000. Any questions on that redesign before we move on? Okay. Sherry, if you want to go to the next slide. So I mentioned the 2025 MOOP smoothing opportunity that's being presented. This is got multiple acronyms, as you can see there, the Medication Prescription Payment Plan, MPPP, MP3. I think that's the M3P is what I'm hearing most commonly right now, but who knows? Just more acronyms to deal with in the industry. This allows beneficiaries to smooth their cost sharing, also known as the out-of-pocket, over the course of the year. We do suspect that we may see some increased utilization, particularly in high-cost medications, as this gives members the opportunity to make payments over time. That's not necessarily a bad thing. You know, it's a good opportunity for people who have struggled to pay for those medications. So I think this can be a great benefit for people in those circumstances. If they opt, this is a completely optional program. It will be offered to them at the point of sale at the pharmacy. And if they do opt in, they will pay $0 at the pharmacy. And then Humana, along with the pharmacy, will determine, well, the pharmacy doesn't determine, but based on the cost of that medication, it will be averaged out through the end of the year to set that payment. And then the member will receive a monthly installment payment request that they would pay to cover the cost of that medication. Questions about that? All right. That covers the changes for the Part D drug plan. And then we do have one benefit change that I just wanted to bring to your attention. Back in 2019, Humana started a pilot program offering special supplemental benefits to the chronically ill. So members diagnosed with conditions such as congestive heart failure, diabetes, and also having food insecurities participating in Humana's case management programs had an opportunity to receive 12 meals per day, or 12 meals a day. Boy, that would not be good. 2 meals per day for 12 weeks. This program is being eliminated by Humana. There was never any cost to KPPA for this. You can see in 2023, we had 196 KPPA members who qualified and took advantage of the benefit. After we introduced this program, we did introduce and enhance Humana's standard post-discharge benefit. So members will continue to have eligibility, all your members, if they have been inpatient in a skilled nursing facility or in a hospital, to receive 2 meals per day for up to 12 days. So that continues. We're just eliminating this chronically ill benefit for your membership. All right.
Tracy,
Yes.
will those what were the 196 members, I think it was?
Yeah.
Will they be moved into other plan, or what will happen to them?
So if they have a hospitalization, they would be eligible for the standard benefit. And this is like, these were short-term benefits. So it was a 12-week benefit that they could receive these food programs. If someone is actively participating in that program at the time of the termination at the end of the year, they'll continue to finish out what they are receiving and be notified. And Humana does have outreach, like as far as food insecurities, if we find people as we are working with them that it seems that they're struggling getting their groceries or putting food on the table or anything like that, we do help them to get connected to community resources that can support them through that process.
And I just don't want those 196 people just kind of get kicked to the curb, as it was, to
Right. Yeah,
and
they will
forgot about. I
definitely.
want to make sure we reach out to them.
Anybody actively receiving that benefit at the time, as we get towards the end of the year, will be notified, and we will work with them to get them connected to additional resources in the community.
All right, thank you.
Yeah, sure. Okay, next slide. We can probably go one more. So now we're ready to talk about the renewal rate. So you can see here kind of a year-over-year comparison of the last 4 years. 2025, the premium plan rate is set to go up to $144.91 per member per month. We have averaged your membership increase over the last 3 years to estimate what we expect the membership will be in the premium plan at $56,274, giving you an estimated annual dollar amount of $97,855,000 and some change there. And then on the essential plan, you can see we are offering a $0 premium on the essential plan. We calculate your estimated membership for that year for 2025 will come in around 5,029, but that is a $0 premium on that plan. If you want to go, Sherry, to the next slide, that will show the breakout. So this is the premium plan components. So the total required revenue based on our calculation, $1,307.59. We are projecting claims at $1,231.20, and that, you may recall, based on the RFP, for the first 3 years of the RFP, there is a 5% rate hold, or not rate hold, but a guarantee that it won't go over that 5%. So that has been accounted for in that projected claims calculation. And then you'll see total net regulatory claims impact. So we've talked about the pharmacy changes, the IRA change, and then additionally, there were changes to the way that CMS calculates the risk score. So that is where some additional premium is coming over and above what we had expected with the rate, with the 5% rate protection. So that's $103.61 on the premium plan. And then retention comes in at $55.31 for this plan. We're expecting CMS reimbursement for medical services at $1,078.44. CMS reimbursement for prescription medications, $84.24, bringing us to the rate of $144.91. Then the next slide shows the same calculation for the essential plan. So you can see total required revenue, $1,035.05, projected claims, $925.59, total net regulatory claims impact, $28.50. We've got retention on this plan at $83.21, and then the CMS Medicare reimbursement for medical, $979.93. And CMS reimbursement on the RX side is $55.21, bringing you to the $0 premium for 2025. Questions on the rate calculations? Okay, there are no questions. We can go to, so the contract continues to include the long-term financial commitments to KPPA. That includes the gain share, which depending on at the estimated MERs, not estimated, but if the MER is met, Humana will share in the savings that we've achieved from that. And then you do continue to have performance guarantees that are reviewed quarterly. Next slide. These are the ASO fees, or the fees that you all pay for the various different programs for the medical only and the mirror plans. So the ASO fee per member per month for the medical only and mirror plan is $31.37. And I do want to note, we've talked about Personify Health as Humana is exiting the commercial business. We are working with Personify Health. I think we may have introduced them as Health Comp, but they are now Personify Health, and they will be administering the claims on behalf of Humana for KPPA. The medical only plan also includes the same dental benefit that the Medicare Advantage plan has. And that fee for 2025 is going to $5.29. And then also with the mirror plan, if someone is on the mirror plan, they do choose to elect the prescription drug medication program that gets, or benefits that get included with that. So for the essential plan, there would be a premium of $10.74. And the premium plan is $149.64. Any questions? All right, that actually concludes the information I had wanted to go over with everyone today. There's some additional slides there that show just the different rating exhibits and everything that Connie and the administrative team received from us, and then some additional information about the IRA, but unless anybody had questions about that, I didn't plan to review them.
Thank you very much, Tracy.
You're welcome.
Patty John, you have anything you wish to add, or we want to move on to this? You're muted.
Yes, sir. Thank you. I think we should let GRS discuss the medical only, and it might be on page 45, Sherry, of board books. I'm not positive, but you might want to go that way. That's the second page of his letter. So GRS, I guess, I'm not sure, Danny or Michael Reed, where you want to be for this discussion of the medical only plan rate.
Yeah, that page is fine. The first page doesn't have much information on it. This year, going into the medical only renewal, KRS or KPPA has continued their favorable experience. So the rate increase is very small at 1.1% on just the claims part of it. So still outpacing trend or outperforming trend, which is great for y'all. And then with the fluctuation, the small increase in the ASO creates the medical only total cost going up 1.7%, which again is meeting trend, so that's good. And then the essential mirror plan this year kind of looks weird because of those changes to the IRA affecting the prescription drug portion of the fee coming in. It did lower that premium, and it is kind of a big chunk on that one. So that premium is coming down by 11.5%. And then the premium year plan 4.1, like again, that change, that fluctuation is just based on the IRA changes going in for the prescription drug part. But overall, y'all have continued the great experience through the membership. So that 1.1%, like I said, doing good.
Good.
Hopefully it'll continue.
Thank you, Michael.
Yep.
Mr. Reed.
Miss, I'm still talking to you there. On page 47 of the board book, the KRS non-hazardous rate is missing on the employer contribution rate.
Christy, you want to jump in here?
Yes, hello. I'm Christy Kiesel with GRS today. I'm not sure I've met all of you, so I'll start with my name. So we do not have the contribution rate for the KRS non-hazardous because that is contributed based on that normal cost percent, which we do not have at this time. So that's where we do have it in that dollar amount down below.
Okay. There's just a obviously missing on that one. That was just kind of wondering.
Yes, we
All right,
so
thank you.
at this moment with these changes, we do not have that impact on the employer contribution rate as a percent of payroll, since the percent of payroll contribution on the non-hazardous side is based on that normal cost dollar amount instead of that full amortization cost, which is that dollar amount that we provide.
Okay.
And I think our only other comment is this is just the isolation of the change in the premiums. And keep in mind that this does not yet reflect the investment experience and, you know, the demographic experience for that point. And then also, this is just the health insurance side, which is much smaller than the pension portion of the cost. So in just kind of giving you the components, the various variables in the contribution effort, and just trying to set expectations that the actual ultimate cost, you know, or the change in costs from last year to this year are yet to be seen.
Anything else we want to do with a GRS before we move on, Ms. Pettyjohn?
No, your voting slide is number 43, Sherry, page, I think. Right there. Yeah.
Yes, 43.
Yes, sir.
All right, the first thing we have to do is the approval of the Medicare Advantage plan, the contribution plan. In 2024, it's a medical only plan. My suggestion is that we also make the medical only plan the contribution plan for 2025.
I'll make that motion,
Thoughts,
Jerry.
discussions, or I'll.
Second.
Thank you, sir. Thank you, Mr. Giannone. All right, so any further discussion for the medical only plan for 2025 as the contribution plan? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. Next is the set the contribution rate. The for 2025 plan year, the 191.95 is medical only plan rate. Last year it was 188.73. So said it did go up a little bit, but within the contract rate. Any discussion on that, or I'll entertain a motion?
I'll make that motion, Jerry, to set the contribution rate to 191.95.
Second.
In a second. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye. Opposed? Motion carried. Next is to approve the premium for the Medicare Advantage and Essential Plan. As we just heard, the Medicare Advantage premium is $144.91, and the Essential Plan is a zero. I like, that's a good cost. I enjoy that one. Any discussion, thoughts, or I'll entertain a motion as the accept those rates.
So moved.
I have a first
I'll second.
and a second. Any further discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carried. The next one will be the medical only or MA mirror plans. We'll set the for plan year 2025, the medical only is 191.95 and their mirror plan is 328.11.
341.59.
Oh, all right. Did I get that wrong? All right.
I thought it was 341.59. After you've got to add in GRS's table. It's on that table, so it's on page 47. Yeah, see, it's, whoa, no, up one slide up. One more, page 2. So, oh, it was right here. So it's 341.59 for the premium and 202.69 for the essential.
For medical only.
And medical only is 195.
Okay. All right. So the only one need to change was the mirror plan to 341.59.
Yes, sir.
All right. Any thoughts, discussions, or I entertain a motion?
Now, with that change, Jerry, I'll make that motion.
All right. Thank you, sir.
Second.
Second. All right. Thank you. Any further discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. All right, let me catch up. Where am I here? The next is selecting the default plan. The medical only plan was the default plan for 2024. Is there a need to change that?
I'll make a motion to keep that the same.
All right. All right, for
Second.
2025, the medical only will be the default plan. I have a first and a second. Any further discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. In accordance,
Mr.
ma'am.
Powell, let me point out that 2B is also approved by the committee. That's the type of exceptions, like someone is undergoing a transplant at another facility that won't take Humana, then we can work with them and enroll them on the mirror plan that will allow them for original Medicare and then a drug coverage.
Oh, okay.
So those just that's allowed as well. Thank you.
To entertain motion to allow enrollment into that non-Part B and the appropriate exceptions as presented.
So moved.
So moved. Second.
I have a first and second. Any further discussion? All in favor say aye.
Aye.
Aye. Opposed? Motion carries. Now, did I get everything? My desk looks like a bomb went off on it from all these notes.
I think you have it, sir, and I'll make sure these slides are adjusted just a little bit for next year.
All right, thank you. Let's see here. We did the medical renewal with GRS. Have any other business? Number 8 on our agenda. This is really good to get through this in less than an hour.
Oh, wow. Well,
Woohoo.
good job.
Great job, everybody. You know,
Yes.
this is a lot of work, and from our retiree health care staff, they put in a lot of time and effort to get us all to where we can understand this, and it's all much appreciated. There being no further business, I will call the meeting adjourned. Thank you all, and appreciate everyone's